Assalamualaikum. My name is Nurliana Balkis and I will present about the introduction concept of ethic and focusing on the Ministry of Health Malaysia. Ethic means having clear standard of right and wrong. It's a guidance how people should behave based on right responsibilities, fairness, benefit of society, and moral values. Different culture may see ethics differently, but the basic foundation always start with laws of the country. Okay, so in the public administration, ethics act as a moral guide. It helps public officials such as make the right decision, treat people fairly, and work with honesty and respect. In a good ethic, we can create trust, integrity, credibility between the government and public. Without ethic, public trust will decrease and government system become weaker. Ethics is so important because public administration support equality, justice, accountability, and transparency. It ensures that resources are shared fairly, decisions are made openly, and power is used responsibly. So let's continue to ethics in the Ministry of Health. The Ministry of Health has its own code, which is Code of Ethics and Code of Conduct. Work ethics in the Ministry of Health include the responsibility, positive attitude, moral values, and others. The role of ethics in the MOH also help to maintain standard and norm in service delivery, provide safe and quality medical service, plan and develop specialist health care service, and ensure continuous improvement in medical service.
Hello everyone, today I would like to talk about my presentation objective. So first, the presentation will explain the definition of ethics. Secondly, it will also explain about how ethics apply in Ministry of Health Malaysia. And lastly, this presentation highlight the importance of apply ethics in Ministry of Health Malaysia.
Standard Code of Conduct in Ministry of Health Malaysia. The Code of Ethics and Code of Conduct of the Ministry of Health Malaysia is a collection of value and moral as well as guidelines in line with the corporate culture of the Ministry of Health Malaysia and Public Service Regulation. The purpose of implementing this code is to serve as a guide and control for the employees of the Ministry of Health in carrying out their duties and responsibilities. Also, indirectly to cultivate and strengthen the integrity of the work of the employees of the Ministry of Health to improve the quality of service to the community. Among the ethical codes of conduct implemented, first one, give allegiance to the Yang di-Pertuan Agong, the country and the government. Employees of the Ministry of Health must always be responsible and comply with the instruction and policy set. For example, a health officer receives official instruction from the Ministry of Health to implement a vaccination program and despite pressure from outside party. The officer still obeyed the government instruction because it was in line with national policy and the interests of the people. Second, protect the image and good name of the Ministry of Health Malaysia. Ministry of Health employees are prohibited from engaging in immoral activity or any other activity that can tarnish the image of the ministry particular and the government in general. For example, when there is an invasion due to the negligence of the hospital staff.
I'm going to talk about moral guide for Code of Ethics in Ministry of Health. So the reason why we need Code of Ethics because it ensures you doing things legally and safely. One of the Code of Ethics for moral guidance in MOH is confidentiality of classified matters. Healthcare staff will ensure that the information and documents are protected and there is no leakage of information. Moreover, this information is limited in access. Other than that, employees of MOH need to follow written laws and regulations that have been made. They need to follow guidelines so that no disciplinary action will be taken against the individual.
Hello everyone. Today I will explain the Discipline Code of Conduct in the Ministry of Health or MOH. In MOH, discipline refers to how employees follow the rules, behave responsibly, and maintain professionalism while carrying out their duties. Discipline is very important in the healthcare sector because it affects patient safety, service efficiency, and the image of the ministry. According to the MOH Code of Ethics, staff are required to follow workplace rules, respect their profession, and perform their duties responsibly. There are many forms of discipline in MOH, but I will focus on two main aspects, which are responsible presence and consideration. First is responsible presence. MOH staff must attend work according to their duty hours. For example, a nurse who starts working at 7 a.m. should arrive earlier to ensure a smooth handover. If staff need to leave during working hours, they must apply for permission and get approval from the head of department. Staff also are not allowed to record attendance for others or leave without approval, as this may lead to discipline action. The second aspect is procedurism. Staff must wear proper attire and official uniforms according to MOH guidelines. Wearing neat and appropriate clothing helps create a professional appearance and help build public trust. Inappropriate or revealing clothing is not allowed because it can give negative impression of the ministry.
To summarize, ethics are very important in country, organization, and individual because ethics foster people to obeying set of principles that determine what is wrong and right. Therefore, the objective of a country and organization can be achieved. The implementation and compliance standard code of conduct, moral guide code of ethics, and discipline in Ministry of Health Malaysia are the main source for forming a credible health service and providing a good view to the citizen. So, the Ministry of Health Malaysia can strengthen its position as the respected and trusted health institution in Malaysia. So that's all from our team. Thank you.